Think like a doctor, sick at the wedding solved. On Thursday, we asked 12 readers to take on a challenging case. A 38-year-old man who traveled to the mountains of Colorado for his brother's wedding suddenly became ill. He had fevers and chills, chest pain, a severe headache and a sore throat. There was so much going on that it was really tough to see what might be underlying it all. More than 400 of you offered your diagnoses, but no one got it completely right. I had to choose 2 winners, each of whom was the first to get at least part of it right. One of the winning answers came from Dr. Hedaya Baradran, a chief resident in the radiology department of Weill Cornell Medical Center. She recognized that an invasive strep infection could cause both the inflamed heart muscle diagnosed at one hospital and the abscess found at the other. She didn't mention the Lemierres. That diagnosis was offered by Dr. Ariratnam Gadikrishna, a cardiologist with Montefiore Medical Center in the Bronx. In 1932, Dr. André Lemire reported on 20 patients he'd seen who became ill with a sore throat and then went on to develop a clot in their jugular vein. The clot was infected with bacteria, and the disease spread from the jugular to the lungs, bones, brain and other organs when tiny pieces broke off, seeding the infection throughout the body. The illness came to be known as Lemire's disease, or syndrome. Lemire's is rare, most commonly seen in teenagers and young adults. And it is frequently misdiagnosed, at least initially. In one study of hospitalized patients, a correct diagnosis of Lemire's was made, on average, 5 days after admission. Most of the time the infection is caused by an unusual bacterium called Fusobacterium necrophorum, but it has been associated with other bugs as well. And no matter which bacterium caused it, in the era before antibiotics, Lemire's was practically a death sentence, with 90% of patients dying. Even now, it's not a disease to be taken lightly. Up to 18% of patients will die of the infection. However, it wasn't some rare infection behind this man's illness. Blood cultures drawn at Anna Jack's Hospital in Newburyport, Mass., where the patient went after returning home, revealed an underlying disorder that is much more common and much less feared: strep throat. There are millions of cases of streptococcal infections in this country every year, usually in the throat or on the skin. But in a tiny fraction of these cases, the bacterium will invade the surrounding tissues and cause a life-threatening illness, as it did with this man. Both the Lemire's and the myocarditis were caused by this strep throat gone wild. This kind of invasive infection must be treated with antibiotics. This patient was taking an antibiotic, doxycycline, because the doctors were worried initially that he might be suffering from some kind of tick-borne infection, but that antibiotic is ineffective against most types of strep.